Hi everyone, this is Katie. Today I'll be introducing one of the inflammatory disorder called Polymyalgia rheumatica. It's also called PMR. Even though it's called rheumatica, actually it is not related to rheumatism. So let's study what this disease is clearly. First of all, PMR is an inflammatory disorder, causes muscle pain and stiffness in the neck, shoulder, and hip area. This disease is more common in people over the age of 50 and affects women more than men. Unfortunately, the exact cause of PMR is unknown. However, nowadays, researchers think it may be our immune system problem. Also, our genes may play a role in this condition. Now, let's look at symptoms. PMR has a variety of symptoms. When people have this disorder, they may experience aches or pain in the neck, shoulder, upper arms, hips, or thighs. Stiffness in affected area, particularly in the morning or after being inactive for a long time, such as a long car ride. Anemia, fatigue, loss of appetite, mild fever, depression. These symptoms usually begin quickly, within 2 weeks. Let's move on to diagnostic tests. To diagnose PMR, a physical examination and blood test will be taken. Doctor will ask patients about their past health and symptoms. Then may gently move their hand and limbs to judge how much their symptoms affect their range of motion. In PMR, results of blood tests to detect inflammation are most often abnormally high. So, the erythrocyte sedimentation rate and the C-reactive protein will be checked for signs of inflammation. However, PMR can be hard to diagnose. So, some other tests such as MRI, ultrasound will be taken to help identify or rule out other causes of symptoms. In addition, sometimes people may develop giant cell arteritis, which causes inflammation in the blood vessel on the scalp and in the vessel leading to the brain, either at the same time as PMR. So, if people experience any symptoms such as new, unusual, or persistent headaches, jaw pain or tenderness, blurred or double vision or visual loss, scalp tenderness, they need to talk to a doctor immediately for taking proper test and treatment. Next, I'd like to explain about treatment. PMR is usually treated with a low dose of an oral corticosteroid, such as prednisone. This is a potent anti-inflammatory medication that will settle the inflammatory condition. People often feel better within the first 2 or 3 days. Most of the time, symptoms improve quickly and go away 2 to 4 weeks after treatment begins. So, if symptoms do not go away after 3 or 4 weeks of treatment, the diagnosis of PMR is not likely, and the doctor will consider other causes of their illness. When symptoms are under control, the dose of corticosteroid medicine will be slowly decreased. Some people can stop taking corticosteroids within a year. However, Others will need a small amount of this medicine for 2 to 3 years to keep symptoms under control. Also, long-term use of corticosteroids can result in a number of serious side effects, such as weight gain, osteoporosis, high blood pressure, diabetes, and cataract. So, when people take the medicine, a doctor will adjust their dosage and prescribe treatment to manage these reactions to corticosteroid treatment. Another thing I'd like to mention is people who taper off the medication too quickly are more likely to have a relapse. So it is very important to keep taking only the prescribed dosage and frequency at the prescribed times, even if they think the symptoms are gone. Also, nurses should support to help patients to observe directions of a doctor. In addition to pharmacotherapy, physical therapy may be recommended to help people regain strength, coordination, and their ability to perform everyday tasks after a long-term period of limited activity caused by PMR. Moving along. Symptoms of PMR can greatly affect a person's ability to perform everyday activities. The pain and stiffness may contribute to difficulties with some tasks, such as getting out of bed, standing up from a chair, or getting out of a car. Bathing, combing their hair, or performing other tasks related to personal hygiene. Getting dressed or putting on a coat. These complications can affect a person's health, social interactions, physical activity, sleep, and general well-being. So, nurses should give some support for people affected by this disease to improve their quality of life, such as giving accurate knowledge of the disease, helping their daily activities and taking medications properly, and providing some information to help them to get helpful services. We are coming to the end of today's presentation. There is a community resource I'd like to introduce. The Arthritis Society is the largest non-government funder of arthritis research in Canada. This society offers various forms of support to improve the quality of life for Canadians affected by arthritis, such as educational events, educational materials, newsletter, support meeting, advocacy, and fundraising for research. Also, they introduce some Living Well guide. So please go to the website to get more value information. This is the end of my presentation. Thank you for listening.